It's Thursday, February 9th, 2012. I'm Curtis Hollister, and you're watching The Quarter on Investor Candy TV. So you get sick or injure yourself, and your insurance doesn't cover the operation you need. Or you just want to do a little body sculpting with a nip here or a tuck there. In the States, the cost can be astronomical. A simple knee surgery can cost as much as $50,000, and for most middle America, this is just a cost that's just too high. Enter Global Health Voyager in the age of medical tourism, trading on the OTC under the symbol GLHV. Here to talk to us about the company and this growing industry is Ali Moussavi, CEO of Global Health Voyager. Ali,
hi Curtis, thank you.
Welcome to the show.
Thank you.
Ali, so medical tourism, everyone's kind of heard about this. It's kind of come in the news and out of the news. You know, what is this business and how are you making it a go as a public company?
Medical tourism has existed for centuries. It usually has been the domain of the wealthy traveling to Western Europe and North America for the best of medical care. But right now, in this day and age, with technology and infrastructure spending in countries like India, Thailand, Indonesia, Malaysia, Singapore, the standard of care in these countries have become comparable or surpassing some of North America, with the cost being a lot lower than it is in North America. Costs in North America are rising.
Yeah. So to that point, sorry to interrupt you, but to that point, I looked at the fact that when we're talking about costs, that there's about 50% of bankruptcies in the United States that are associated with the expenses of surgeries or medical costs.
That is a sad and true fact. People are just it's backbreaking, these costs, and this is an alternative for people that are underinsured, uninsured, or for employers that like to send their employees abroad to get a comparable treatment that they can in the United States for a lower cost, and later on passing some of the savings on to them.
Well, we mentioned, let's talk about the economics of it. We mentioned that, for knee surgery as an example, most people as they get into their 60s, knee surgeries, elbows, hips, all of these things are quite common. And then you've got more, severe surgeries like heart-related surgeries, etc.
Sure.
If it costs $50,000 in the States to get your knee replaced, what does it cost if you go abroad?
Let's talk about a hip replacement, which, for example, happens to be the most popular surgery that people travel abroad for. It costs between $45,000 and $50,000 in the US. It'll cost between $13,000 and $15,000 if you go abroad. That's with surgery, your stay, with a companion, travel expenses.
And you're saying that employers are actually paying that and then giving a bonus of part of those savings back to the employees in some cases?
Absolutely. That's how they're incentivizing their employees to go, because that is the only way that they can keep up with the expenses.
And obviously,
otherwise, the medical expenses, the health insurance expenses in a small corporation, say 500, 1,000 to 5,000 people, could actually bankrupt the company.
I mean, exactly. So instead of paying $50,000, the company's paying $15,000 and giving the employee an extra $5,000 kicker.
Yes.
They say $30,000. The employee gets the same surgery, and obviously the economics of that are much more palatable.
There are examples of this on CNN. Your viewers can search for it, medical tourism, CNN. There's stories of this all over the place, that how employers are jumping on the bandwagon. And this really is the promise of medical tourism, because the volumes are not quite there yet, but the capacity for the volume is there abroad. We can absorb a whole bunch of employers.
So your business model is as a full service kind of facilitator of this process. So what happens, how are you guys growing the business? Are you signing on employers then? Are you, what are you doing to grow the business?
Curtis. We are trying to take advantage of probably one of the largest arbitrages left on earth. That's the way we look at it. Now, we tackle that in two ways. Number one, we want to become the brand that recognizable and synonymous with medical travel. We want Global Health Voyager to be that brand. In order to do that, we want to grow the company organically and by acquisition, because it's companies that do what we do are very sporadically located around the United States. They're run by expats of countries that they send their patients to, mom and pop operations. We like to roll up quite a few of them and pretty quickly. And in a business like this, the people are your assets. So we've already identified 52 acquisition candidates that we're talking to and having a conversation with. And the other side would be the employers, which that they're called private insurers, the people that pay into their own insurance fund. And we're going on and signing these people on also. On the facilitator side, we are signing more accredited hospitals and institutions abroad. So we will have the bandwidth to send our newly acquired patients there.
And so from the point of view of growing the business, do you guys think within 2012 you're going to be able to start pulling the trigger on some of these acquisitions?
Absolutely. Absolutely. That's these are, everybody realizes that it's in this business and there's strength in numbers in this business. You know, we can, these are very synergetic acquisitions. You know, one facilitator might be sending patients to Mexico while the other one concentrates on India.
And obviously this gives them a path to liquidity as well. You guys, from my understanding, are the only pure play company within this space that's publicly listed.
Absolutely, we are. A few years ago, maybe 3 years ago, Barron's did an article introducing investors to medical tourism, and they wanted to come up with some recommendations, and all they could come up with was a couple of hospital groups in Singapore and India that 25% of their patient base comes from abroad. Now, if you think about it, that's a very indirect play. Global Health Voyager is a very direct play in the same field.
And you guys are going to be looking at possibly ways of even financing or underwriting the costs of these reduced costs instead of
absolutely.
So you've got an opportunity of being kind of taking your revenue share off of this wave of new deal flow effectively from all these different smaller players, and then the ability to kind of underwrite and financially kind of enable people to start to do this internationally. Because if it's just a case of like signing the dotted line and here's your financing, I think a lot more people will do that rather than delaying or not getting an operation for somebody in your family when the alternative is bankruptcy.
That's right. That's right. And we're making the financing aspect of it very available to people, and that's the way it should be. You know, and you're right. I mean, it is a human right to be able to live in a first world country and get financing if you can get the healthcare you need over here to get it abroad. Absolutely.
So we got roll-up strategy. You should be seeing kind of deal flow with this year from the point of view of some acquisitions. Obviously, you guys are going to be starting to announce, new employers as they sign up, and then the ability to actually sign on more of these hospitals that ideally become recognized within. Once you need these surgeries, you're kind of paying attention more as the kind of milestones that we're talking about so far.
Absolutely, that is our plan. It's a three-pronged plan. Sign up employers, sign up more institutions, JCI accredited institutions, that's Joint Commission International. It's a body that compares the standard of care to the best hospital in the US, and signing up getting more people to go.
Well, I mean, and I think next time I'd love to have you on the show again, and we maybe have a doctor from one of these hospitals, or ideally a patient that's gone through this process to see, to kind of humanize the process. Because, I think people are going to be doing this more and more if the alternative is going bankrupt.
But we can do both, actually, if you like.
Perfect. Ali, thanks so much for your time.
Thank you.
If you'd like more information on Global Health Voyager, you can visit their ticker symbol, which is GLHV on the OTC. If you'd like more videos from industry experts or public companies, please visit investorcandy.tv. I'm Curtis Hollister. Thanks for watching.